What if I told you the White House just launched a website that could cut prescription drug prices overnight? Without insurance, without pharmacy middlemen, without the system you've been forced to navigate your entire life. And the man announcing it? Donald J. Trump. This is TrumpRx. And depending on who you ask, this is either the most radical healthcare disruption in modern American history, or a carefully staged experiment that exposes just how broken the system really is. Because this isn't just a website. This is a challenge. On Thursday night, under national attention, President Donald Trump stepped forward and unveiled something unexpected. Not a bill, not a proposal, not a campaign promise. A live, direct-to-consumer prescription drug platform, TrumpRx. And his message was bold and simple. You're going to save a fortune, and this is so good for overall healthcare. No insurance required. No complicated approvals. No endless paperwork. Just cash prices, visible, upfront, and direct. In American healthcare, that alone is revolutionary. To understand why TrumpRx matters, you have to understand something most people never see. Prescription drug pricing in the United States is not built for patients. It's built for insurance companies, for pharmacy benefit managers, for rebate structures, for negotiated markups that happen far away from public view. When you buy a medication today, you're almost never seeing its real cost. You're seeing a number inflated by layers of middlemen, administrative complexity, and incentives that reward confusion. That's why the same drug can cost wildly different amounts depending on who you are. That's why insured patients sometimes pay more than people paying cash. That's why nobody can explain why prices are so high, except that it's complicated. But complexity isn't accidental. It's profitable. TrumpRx cuts straight through that system. Instead of routing patients through insurance, it asks a question that feels almost illegal in modern healthcare. What if you just paid the real price? You go to the site. You search your medication. You see the cost. No hidden negotiations. No surprise copays. No deductibles kicking in months later. And instantly, this helps a massive group of Americans. People without insurance, people with limited coverage, people paying out of pocket, people skipping medications because the price is simply too high. For them, TrumpRx isn't political, it's survival. Now, let's be honest, because this is where the conversation gets uncomfortable. TrumpRx is not designed for everyone. If you already have excellent insurance coverage, low copays, and comprehensive benefits, you might not save more than you already do. And that's why critics are quick to say, this won't help all patients. But here's the truth they don't say out loud. The current system already doesn't help all patients. TrumpRx targets the people who were left behind. And that population is far larger than most people realize. And that's exactly why this is shaking the industry. Because if enough people choose transparent, cash-based pricing, the insurance-first model starts to crack. Once patients see real prices, they start asking dangerous questions. Why was this ever so expensive? Why did insurance make this harder, not easier? Who was benefiting from the confusion? TrumpRx doesn't just sell medication. It exposes how the system actually works. And that exposure is threatening. Because this isn't just healthcare. It's power. For decades, drug pricing lived in the shadows, protected by complexity and silence. Trump just dragged it into the light. Whether you support him or oppose him, this move forces transparency, and transparency is the enemy of monopolies. That's why this moment is politically explosive. Trump isn't framing TrumpRx as a small experiment. He's framing it as proof. Proof that prices don't need to be this high. Proof that middlemen aren't essential. Proof that government can bypass entrenched interests when it chooses to. Supporters see this as a populist strike, a win for working Americans and a direct challenge to corporate healthcare. Critics see it as risky, oversimplified, and politically charged. But both sides agree on one thing: this is disruptive. Now, let's slow down, because there are still unanswered questions. Which drugs will offer the biggest savings? How sustainable is this long-term? Will the platform expand? Will insured patients ever benefit more than cash buyers? TrumpRx is new, and new systems reveal their limits over time. But disruption doesn't require perfection. It requires momentum. And here's the deeper truth. Once Americans experience direct pricing, once they see that healthcare can be simpler, clearer, and more honest, there's no going back. The illusion breaks. TrumpRx may evolve. It may face resistance. It may change form. But the idea is now alive. So here's the real question. Is TrumpRx the future of American healthcare, or just the first crack in a system that can no longer survive secrecy? Because if this works, even partially, it rewrites the rules. And the people who benefited from the old rules? They're watching very closely. This isn't just about Donald Trump. It isn't just about a website. It's about who controls access to medicine and who finally gets to see the truth behind the price tag. And whether TrumpRx succeeds or fails, one thing is certain: American healthcare has officially entered a new phase.